Welcome back. Has pain in your legs or embarrassment from exposed veins sidelined you from activity? In our West Michigan Moves segment brought to you by Mercy Health, you need to know that you're not alone. These are a widespread concern for many people in the United States. Modern advances offer minimally invasive procedures to improve people's quality of life. Michelle Kosovec, a vascular surgeon, is here to talk about the importance of recognizing the causes, symptoms, and the big one, treatment options. Thank you so much for being here with us.
Yeah, you're welcome.
So let's separate the two first of all to start out. Let's start with varicose veins. What are those? What's going on with your body?
Yeah, so the veins, they carry blood back to the heart, and they have a series of one-way check valves that help to do so against gravity. And so if those valves become faulty, the vein will pool in the legs and it will cause what we call reflux and the bulging veins that are called the varicose veins.
Okay, and is that what we're going to look at right there?
Some of those smaller ones there, those are the spider veins there that you see.
Okay.
And then varicose veins are also a little bit bigger than that under the skin.
Okay, since we kind of brought up the varicose and the spider right there, why don't we go ahead and tell people what the difference is?
Yeah, the varicose veins, they're the more bulgy ones that are under the skin, and then the spider ones are those little tiny ones that you can see along the surface, and those ones are often also related to that underlying problem with the faulty valves.
Is this something that happens in men and women both?
Yes, it can happen in both men and women, yep.
I've noticed actually a lot of women who are pregnant after the fact seem like they get those. Does that seem to be a common thing?
Oh yes, that is very common. People will, women that are pregnant can get them. They can also run in families as well.
Okay, so let's go ahead and talk about how one gets evaluated to see if varicose veins is what's going on.
Yeah, so we do a comprehensive history and physical exam right in our office, and then typically it requires an ultrasound to look at the veins, and then we give those results back to people the same day and come up with a plan for treatment.
So when you do the ultrasound, that's nothing painful that's going on,
Oh,
right?
no. Yeah.
All right, so if I want to go ahead and treat them, people just think, all right, I have them, I have to live with them. So be it, right? It runs in my family, but you have treatment options available.
Yeah, so there's a few minimally invasive ways that we're now able to treat them. One of them is called ultrasound-guided radiofrequency ablation, and that long word just means that we use heat to treat the veins. There's also a way called microphlebectomy. We make some small incisions and actually disrupt the veins themselves. Or for those spider veins, there's a medicine that we can use that will help to get rid of them.
Is this something that can happen within one visit? Is this something that's over a period of time?
Yeah, so we usually are able to take care of this in one visit. When you come in for your treatment, then you can usually, it takes less than an hour. It's an outpatient office-based procedure that we do right there.
Okay. And I never realized the pain that was associated with some of this, but actually one of the benefits of getting the treatment is that you are free from some of the pain.
Yeah, so people can have pain at the sites, and our main goal for people is to get rid of their symptoms, and so those symptoms can range from pain at the sites to swelling in the legs. They can have even some bleeding or non-healing wounds because of the veins as well.
So I'm guessing that leads to the next question. If you leave this untreated, are there further complications that could take place?
Yeah, so if left untreated, people can have some permanent skin changes, they can have bleeding, they can develop some non-healing wounds, or their pain can it'll just continue to bother them for a long period of time. And
this is something that affects people of all ages, or is there a certain age where you kind of start to see it and then, it's more common maybe later in life?
Yeah, I mean, certainly you mentioned pregnant women will oftentimes have issues where that starts, and then over time, as well as people are on their feet for long periods of time, for long periods of the day, that can also promote some of those faulty veins from forming.
And if someone's looking at their legs right now and say, I don't have them right now, I must be doing something right, prevention, way to prevent them?
Leg elevation, oftentimes compression stockings will help, and that is at least really good for some temporary relief. And then if that doesn't work, then we can go to some of those other treatment options that I talked about.
Okay, great. That's nice for people to know. So maybe next summer, if they're hiding their legs this summer, they know that next summer they can actually go out there and show them off. Yes. All right, thanks so much for stopping by, Michelle.
Thank you.
Sure. If you think you or your loved one suffers from varicose veins, call Mercy Health Physician Partners Vascular Surgery at 616-685-7850 for a consultation, or you can go to mercyhealthheartandvascular.com.